We could spend that money to let patients see dentists. We could spend that money to let patients pay for hearing aids, to help older adults afford eyeglasses, to bring down the cost of prescription drugs, to finally pay mental health professionals for the work they do. Instead, all this money is wasted. Dr. Collins, what percentage of revenue do private insurance companies spend on administrative costs?
Between about 17 to 18% of spending in private insurance plans.
So if I pay my insurance company $100, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, $17 go to administrative costs. What about Medicare? What do they spend on administrative costs?
That range is about 3 to 5%.
3 to 5%. About 3 to 5%, right here. And if we look at just billing costs, just billing and insurance costs, Medicare is at 1%. Wait, private companies spend 17 times more on administrative costs than Medicare? What are private insurance companies spending on that Medicare is not? Does Medicare spend hundreds of millions of dollars on television advertisements like private insurance does?
No.
Does Medicare spend millions of dollars on stock buybacks to shareholders?
No.
Does Medicare spend money on marketing? Private insurance likes to put its name on stadiums and PGA tournaments. Is there a Medicare arena?
No.
Does Medicare spend $23 million on executive pay like private insurance companies do?
No.
We know how much it costs to run a high-quality health insurance program. $1. Out of $100, research shows that Medicare spends 1.1% on administrative costs. We spend $4 trillion on healthcare every year. We could save $200 billion on administrative costs with Medicare-for-All. And those savings, they could go to expand Medicare. We could spend that money to let patients see dentists. We could spend that money to let patients pay for hearing aids, to help older adults afford eyeglasses, to bring down the cost of prescription drugs, to finally pay mental health professionals for the work they do. Instead, all this money is wasted. We're not talking about paying to keep the lights on in operating rooms or improving the quality of care. All this money is used to pay big insurance to push paper. It's death by 200 billion paper cuts. Is $200 billion on administrative costs. Now, administrative costs waste money, but they also waste healthcare workers' time. A recent study found that a majority of doctors, 56%, support a single-payer healthcare program. Why? Because today doctors spend only 1/4 of their time with patients. What are they doing with the rest of their time? Paperwork. And I want to add, not only would 50 to 56% of doctors support Medicare-for-All, but patients would have the most choice under Medicare-for-All. The health insurance coverage with the biggest network is Medicare. No private insurance comes close. 99% of non-pediatric doctors participate in Medicare. So I want to recap. Medicare-for-All would save money on administrative costs, $200 billion a year. Medicare-for-All would give patients the most choices, 99% of non-pediatric providers, and Medicare would let doctors practice medicine. Not surprisingly, given these three things, what do we get with Medicare-for-All? Better health outcomes. And that's why I support Medicare-for-All, because I support patients over paperwork.